Good afternoon. My name is Gina Duncan, and I'm the statewide director of Transgender Equality at Equality Florida. I am an out, proud transgender woman, and my pronouns are she, her, hers. Gathered here today is a broad coalition including Equality Florida, partners at Pride Lines Miami, Planned Parenthood of Florida, Faith in Public Life, Alliance for LGBTQ Youth, Transgender Parents, Don't Cross Those Mama Bears, and many others to raise the alarm about the dangers of the Transgender Youth Medical Ban bill, a dangerous and harmful piece of legislation that's being heard today in the Florida House. We are here to stand together and demand that the Florida legislature see these attacks on LGBTQ people, and especially over the last 3 years on the transgender and non-binary community. House Bill 1365, the Transgender Youth Medical Ban, is a dangerous and mean-spirited bill that would jail doctors up to 15 years for providing life-saving, best practice care for transgender youth. Filed in the 11th hour, HB 1365 is the most egregious of the hate slate, a slate of anti-LGBTQ bills introduced this session. This deliberate targeting of transgender people is all the more shameful given Florida's recent history of deadly violence against the transgender community. Violence that we have seen span the last 2 years, where 7 transgender Black women have been murdered in the state of Florida. In all of those cases, they were also misgendered by the media. We see this hateful rhetoric being spewed by the Trump administration. This gaslighting against the transgender community is truly now finding its way into the South and into Florida. This gaslighting is something we cannot tolerate and we must not tolerate. We thought that even though this was going on at the federal level, we thought that when they go low, at least we could go local. But we're finding that's not the case. Instead of denouncing anti-trans hatred, leadership in the Florida House has instead decided to hear a bill that endangers transgender children, our most vulnerable. We're here to say with our collective voices that this is the wrong direction for Florida. This is the wrong direction for our trans youth. We urge lawmakers to reject these attacks and instead embrace the popular, bipartisan, and widely supported protections offered in the Florida Competitive Workforce Act, a bill introduced 13 years ago to treat everyone equally under the law in the state of Florida. We should be working together to end violence and discrimination in our state, not introducing a hate slate. Today's workshop on HB 1365 comes at a time when the voices of business and the public could not be more clear. There is no appetite for discrimination. In fact, national headlines are reporting businesses like Wells Fargo, Fifth Third Bank, and Wyndham Destinations have withdrawn support for Florida's private school program, voucher program, after discovering some of the program's beneficiaries have anti-LGBTQ policies in place which hurt our LGBTQ youth. As we speak, the public and voices of businesses are demanding that we protect our children's young, our state's young. And yet still the Florida House mounts this attack. This is the wrong direction. It is flat out the wrong direction for Florida. Today you'll hear from the families of those affected by this destructive and harmful legislation. Transgender youth medical care bans, including advocates, will speak against this bill on a first-hand basis. They know what it's like. They know the importance of quality health care for their transgender youth. I'm pleased to bring next to the microphone Jeanette Jennings. Jeanette is the mother of internationally recognized activist Jazz Jennings of TLC's I Am Jazz. You'll also hear from medical experts across the state who know that it's doctors providing trusted standards in affirming care that are what our transgender youth need. Thank you for being here. Thank you for elevating this discussion, and thank you for highlighting this hateful and onerous bill towards our transgender youth. With that, Jeanette.
Okay. First, I'd like to surround myself by all the parents of transgender youth that are here today. Okay? Everybody here? Okay. I'm also surrounded by my lovely son, Griffin, and Sander. I'm actually the mom of 4 beautiful children. My youngest child, Jazz, is transgender, and although assigned male at birth, she's a beautiful 19-year-old young woman who is only alive today because she received life-saving medical care. When people criticize and question me and my husband, Greg, for allowing our child to live as her true self, the answer is simple. We'd rather have a happy, living daughter than a dead son. Thanks. According to a new study by the CDC, transgender youth are at much greater risk of suicide. However, if they have access to puberty blockers, their chances of suicide and mental health problems decline significantly. Jazz herself has told us that if she was forced to go through male puberty, she would have taken her life. As a young child, she'd have nightmares about having facial hair. If you could see her brothers, right there. She didn't want to. My husband, too. After extensive guidance from medical professionals, we promised we'd do everything in our power to ensure that Jazz would be able to live as a girl. Kids like her face discrimination, bullying, cruelty on a daily basis. So they look to all of you for help, but instead they're up against HB 1365, which will only cause them more pain. Jazz's own life has been a series of battles, and she has suffered. At 4, she was expelled from the playground by a bigoted preschool director. At 5, she began kindergarten and was banned from the girls' restroom. At 6, she was told she couldn't be called by her chosen name. At 7, she began urinating in her uniform because she didn't want to be forced to use the nurse's restroom. At 8, she was banned from playing girls' soccer. At 9, she struggled to find medical care in Florida. But finally, at 11, she found a compassionate doctor who was willing to treat her with hormone blockers. Her nightmare of developing secondary male characteristics would never come true. And instead, she's fulfilling her dreams, changing the world on her own terms. And I'm proud to say she will be attending Harvard in the fall. Thank you.
Thank you, Jeanette. So powerful and so important. Next, I'd like to ask Sally Hogshead to come to the microphone with her son, Asher.
Oh, yes, of course.
Hi. Let me introduce my son, Asher.
He's the
One of my first memories is me in kindergarten, pre-K, at age like 4, and I was sitting atop one of those slides, the yellow kind of slides that come in those big recess grounds. And aside from me was sitting a boy, and he asked if I was a boy or a girl. And it was a reasonable question because at that time I kept my hair really short, and I refused to wear any kind of girl's clothing. And I looked at him straight in the eyes and I said, "I'm a boy." And it's around that age that you learn the difference between what a lie is and what a truth is. But that answer just felt so true to me that I was perfectly comfortable telling him that, even though at that time it wasn't the whole truth. When I was 11, I started going through female puberty, and I remember looking in the mirror and I just felt so disgusted and ashamed, and it was this tangible kind of hatred that I could feel in my throat, in my hands, and this hot, swirling heat in my cheeks. I didn't transition because I wanted to. I transitioned because I had to survive. after I came out, I'm the happiest I've ever been. I taught myself electric guitar, I play goalie and ice hockey. I'm in my school's theater troupe, and what's important to know is that it's not in spite of my transition that I get to do these things, it's because of it. It's not in spite of my transition that I get to be the person that I am today, it's because of it.
Yeah!
We love you, Asher.
Awesome.
As a mom, I just need a moment. In early 2015, we took our kids to San Francisco, and we were sitting in a restaurant, and my daughter, who was 11 at the time, she drew something on her napkin. And she walked outside of the restaurant, and I could see her standing there. I could see her through the window, and here's what I saw. She was holding her napkin up like this, and when people walked by at 5 p.m. on a San Francisco corner, they stopped and they looked at what this little girl was holding written on this piece of paper, and they burst into a smile. It was like this happy bubble was bubbling up in them, and then they walked on. So I went outside, I wanted to know what was written on this napkin. And it was written, "You are awesome, just the way you are." My daughter had written, "You are awesome, just the way you are." And we came home and I saw that my daughter began getting depressed. She had a crippling depression. And if you have kids, you know, watching your child go through the agony of that kind of depression is horrible to watch. And finally, I found out what the depression was. I found out that I didn't have a daughter, I had a son, and his name is Asher. This wasn't a transition, this was a transformation. The moment, literally, the day that Asher came out as my son, it was like the light came back on in his eyes. I had my child back. And so we put a family plan together. We put a plan for this transition. We knew that we had to be sensitive to other people. If we wanted them to accept us, we had to understand that they wouldn't get this immediately. Look, I get it. Transition is hard to explain. I talked to my 83-year-old parents about this. My dad's a retired orthopedic surgeon. He's based in research. And after he did the research and he saw the statistics on suicide, he said, "Asher, I love you, and you are my grandson." And so we put this plan together as a family. We did the haircut gradually. We talked to the school, we talked to his friends' parents, we talked to our family, and finally he came out at school, and there was vicious bullying. 2 kids were expelled, the 6th grade. And I said to Asher, "What do you want to do about this? Do you want to move? We'll move." And he said, "Over the summer, I want to start a gay-straight alliance." And so the first day of 7th grade, the first day back, Asher was there with a card table and a sign-up sheet and a goldfish bowl with candy for kids walking by at a school of 1,500 middle schoolers that supposedly had never had a transgender kid and didn't have a gay-straight alliance, and he had 72 kids sign up. And now let me tell you, Asher since then has been named Student of the Year. His hockey coaches have given him the Coaches Award for Best Team Spirit 3 times. He won an award from Disney, their highest honor for writing, named Dreamers and Doers. He wants to be a human rights advocate. Asher is going to change the world. And he didn't have to change who he is. Asher became who he is. He didn't change who he is, he became more of who he was and is and always will be. So I can't speak for other parents. I can't speak for other parents. I can only speak for myself and say I just want what every parent wants, which is a child who is confident and happy and safe, and we would not have that if it weren't for the doctors. So I want to say thank you to all of us. Thank you to Equality Florida. Most of all, thank you to the doctors who've made our family possible. Thank you.
You know, once again, we would urge the Florida legislature to watch this, hear these parents, know the importance of being able to support our transgender youth and support them with best practice health care. Now is the time to step in, not step out, in reference to supporting all of our transgender youth across the state. So not only do we have parents who are sounding the alarm that this bill is wrong, this bill is harmful to our young, we have medical professionals who are also leaning in to let you know medically this is the wrong course of action. I'm very pleased to introduce to you Dr. Janet Silverstein from the University of Florida, pediatric, and she is a University of Florida pediatric endocrinologist. She's also with the Alachua Youth Gender Project, and we're so pleased to have her today speaking. Janet. No worries.
Oh, dear. Hi. I have done a lot nationally and in the state of Florida. I was president of the Pediatric Endocrine Society. I was the head of the section of endocrinology for the American Academy of Pediatrics and on the board of the Florida chapter of the American Pediatric Society. So basically, I've always been interested in advocacy and doing what's best for our patients. And probably about 4 years ago, I realized just how serious the issue was with the lack of adequate care for transgender youth. This was a very marginalized population, high rate of suicide, very high rate of depression and anxiety, and I said, I'm starting a clinic. And I did. And I recruited a wonderful psychologist and a wonderful transgender male who serves as our patient advocate and resource person, and who actually gets more phone calls from our call center than anybody else. And it has thrived. We started with one clinic every other week. We had to quickly go to one clinic once a week. Then it's one clinic twice a week. Now it's one clinic 3 times a week is going to be, and we still have a 6-month waiting list for new patients. So there's a real need for medical care for these kids. And I had in my phone everything I was going to say, which I can now not get.
Here we go.
So anyway, here it is. So basically, I am really concerned about this bill. It will definitely compromise the health of trans youth across the state of Florida. You know, research has consistently shown that affirming trans youth in their gender identity improves health outcomes and reduces suicidality. You know, we've had a couple of kids who've actually attempted suicide and who, after transition, are just perfect, normal as far as their approach to the world, happy, and just totally turned them around. A paper published last week, and I think it was referred to by Jazz's mom, in pediatrics showed that suicidality, if that's the word, if there is a word like that, anyway, really decreased markedly in patients who received hormone blockers. And this was not a surprise. For doctors, this bill is really a problem. When we graduated from medical school, we made an oath, the Hippocratic Oath, that we would do no harm. And I think that's an oath everybody in public service should take. But this bill really compromises our ability to do our jobs and follow the Hippocratic Oath. It would force us to choose between saving the lives of our patients by following standard medical protocols that have been in place and are evidence-based and do not harm patients, or facing jail time. This is an absolutely untenable and unethical position to put us in. Criminalizing basic life-saving medical care would not only harm this population of exceedingly vulnerable young patients, but also deter doctors from practicing in our state generally. I would never practice in a state that had this law. Transgender youth deserve quality medical care from practitioners around the state who have experience treating them, and this bill would put a stop to that care and jeopardize their lives and their safety. The treatment protocols that this bill criminalizes are not only supported by trans youth and their families, but also by every major medical association, including the American Medical Association, the American Academy of Pediatrics, the Endocrine Society, the American Pediatric Association, and others. They all support treating transgender youth. So I really encourage everybody to reach out to their legislators and let their voice be heard, because this is a dangerous bill that needs to be stopped.
Thank you so much. Thank you, Dr. Silverstein. And now it's my pleasure to introduce Representative Carlos Smith to say a few words and to introduce the other elected officials who have joined us this afternoon. Carlos Smith.
Thank you, Gina. I also want to thank some of my colleagues who are here standing with trans youth in solidarity: Senator Victor Torres, Representative Margaret Good, Representative Anna Escamani, and thank you to all of the families and parents and trans youth and advocates who are standing beside us and with us in this fight. Thank you, Jeanette. Thank you, Sally. Thank you, Asher. My name is Representative Carlos Guillermo Smith, and I am a member of the Health Quality Subcommittee that will be hearing this bill today. I oppose this bill with every bone in my body and every fiber of my being. I compel my colleagues to listen. My colleagues need to listen. Listen to these families who are horrified at what might happen if we criminalize life-saving care for their child. Listen to the parents who know what is best for their own child. Listen to their stories. Listen to the real experts who actually understand how to provide health care and treatment for transgender youth. Listen to the CDC, which recommends providing access to culturally competent physical and mental health care for improving the health of transgender youth. Listen to the American Academy of Pediatrics that recently published a report that says that life-saving care for trans youth helps make them less likely to commit suicide. Listen to the American Psychological Association. Listen to the American Psychiatric Association. Listen to the Endocrine Society. Listen to the American Medical Association. Listen to the overwhelming consensus of the science-based medical community. And open your eyes. Open your eyes to see that Florida is #1 in the nation for the number of Black transgender women who have been murdered. And fully understand the consequences of your actions. Do not listen to hate groups. Listen to your heart and never let this bill see the light of day ever again. Let the decisions about medical treatment for gender expression to be left up to a young person, their parents, and their doctor. And I have a message for the trans youth who are here with us today and those who are listening at home. We see you. We got your backs. Your life matters. We love you, and you are perfect just the way you are. Thank you.
We all stand together to urge that this bill die. This bill needs to be killed before it kills a young person. And with that, we'll take questions from the media, if there are any.
It seems like the argument that Representative Sabatini is making is that children don't understand the consequences of this and should be delayed until they're adults. So how would you respond to that?
I would respond to that is that young people, as you probably know, understand fully who they are and seek to be their true and authentic selves. We see that younger and younger transgender and non-binary people are seeking to be their authentic selves and pushing for support in doing that. The parents get it, the medical community gets it, healthcare professionals get it. Now we need our lawmakers to get it. It's up to families to make decisions for their young, for their youth who are going through this process so that they can be their true selves.
And we want them to be alive.
And we want them to live through it. Absolutely.
Yes.
Other questions? Yes, ma'am. Yes.
On the Health Quality Subcommittee today, what do you hope happens in this workshop, and what would be an ideal outcome for
I hope that people really understand what trans youth go through. The process of having to come out to your family and your loved ones. The fact that trans youth who are privileged and lucky enough to have supportive families and have access to health care, once they finally consult with a doctor, it is after a tremendous amount of discussion, reflection, social transition, dialogue, conversation, and thinking with their parents about what the next steps are to make sure that child is safe. The sponsor of this bill has made it very clear through comments to the public that he does not understand what is in the best interest of transgender youth. And that is what we want the committee to see through testimony today, which is that the one organization that has been brought forward as an expert on transgender youth is actually been designated by the Southern Poverty Law Center as a hate group. That is the American College of Pediatrics. Look it up. They are a hate group. They actually were formed in 2002 after they broke away from the larger, more trusted association because they were so angry that that organization had taken a position in favor of allowing gay parents to be adoptive and foster parents. Why should we listen to anything that they have to say on this issue?
Any other questions? Yes.
So is it right that there was going to be a vote and then now it's a workshop? What was the process? Why was it turned into a workshop? Did you guys have influence on that?
Look, the goal of today's hearing as far as what has to happen in educating the committee to protect trans youth from this bill ever seeing the light of day, this is real. This is a real danger. But the fact that the bill was turned into a workshop and the vote was canceled says a lot about what happened when Republican lawmakers started to open their eyes to really understand the dangerous consequences of this bill.
We have time for one more question. Okay, with that, thank you for coming out. Thank you for shining a light on this very important issue. And let's kill this bill.
Thank you.
Thank you.
Good job.
Thank you so much.